Ovarian cancer is one of the deadliest cancers affecting women in this country, and it's on the rise. So to mark World Ovarian Cancer Awareness Day today, we are shedding light on the realities of a diagnosis and why early detection is key. Terri McGraw was diagnosed with stage 3B ovarian cancer in 2020 at the age of 54 and is about to restart chemo for the fourth time. She's agreed to share her story with us today, and we are very grateful for that. Thanks for joining us, Terri.
Yeah, thank you for having me.
I know ovarian cancer is often referred to as the silent killer because of its subtle and sneaky symptoms. I'm curious, what, if any, did you have leading up to your diagnosis?
I had very subtle and sneaky symptoms as well. I had a little bit of low back ache and a heavy feeling in my pelvis, a kind of a pressure feeling. And I didn't have it all the time. It wasn't very often. And it wasn't very severe. But I mentioned it to my doctor and asked for an ultrasound, and that's how things got started.
We know early detection really matters when it comes to treating ovarian cancer. Did you catch yours early enough?
I did not. I had an ultrasound in 2020 that showed a cyst, but it wasn't until 2021 when I had a repeat ultrasound that it showed the cyst had now become concerning for cancer, and by that time it was already stage 3B.
So that means you can't stop the spread of it, correct?
Correct, yes.
What have your options been to date to battle this cancer then?
I had surgery, and they did a hysterectomy and removed all visible cancer they could find. And at that time, they deemed my treatment as curable. And I went on 2 types of chemotherapy and had a CT scan later that showed I had no evidence of disease left, which was wonderful. However, 9 months after my chemo, I had another CT scan that showed that I had a recurrence. So at that point in time, they deemed me not curable, and I had the same type of chemo that I had had in the past because that was the best that was available. And I've actually not had any different type of chemo yet. I've had the same type of chemo 3 times because that's the best option for me.
What is your prognosis?
I don't ask that question really. In terms of time, I know statistically there's less than a 50% chance of surviving 5 years. I am already at 4 years. My doctor did once tell me she would be very surprised if I survived 10.
I'm so sorry to hear that, Terri. You know, hindsight is everything. I'm curious what your advice is to other women. What can we learn from your experience?
I think it's important to know and understand how our body feels. And I also think that it's important to know what to look for things that are wrong. And so in ovarian cancer case, we need to know what symptoms are. Early symptoms, if you have any, are things like bloating or full feeling in the abdomen or pelvis, maybe low backache, feeling full easily or not being able to eat well, urinary bladder changes and maybe some pain, and then get yourself to the doctor if these symptoms persist for longer than 3 weeks or are regular. Ask your doctor for a pelvic ultrasound and also for a blood test called CA-125. That can be helpful as a tumor marker in ovarian cancer, but it by itself is not diagnostic. It's part of the pieces of the puzzle. So know your body and advocate for yourself.
That last part, very key, advocating for yourself. We know healthcare has its challenges these days. When you look back, do you wish you might have done things differently, or is there advice there that you can offer?
I wouldn't have known any better to go to the doctor any sooner because I didn't have any symptoms. But when I had my first ultrasound in 2020, it was in April, and I was supposed to have a follow-up 3 months later. It was COVID and appointments were delayed, and that follow-up didn't happen for 9 months. Looking back on it, I wish that I would have pursued that 3-month ultrasound harder, but I didn't know to do that.
Well, ladies, Mother's Day right around the corner. I want you to remember Terri's words and her story today. Terri, we wish you all the luck in this battle ahead of you, and we really appreciate you educating all of us.
Thank you.